Partnerships. I'm Christine Price, Chief Officer of Healthwatch. I'm going to start the introductions and I'm going to be the first presenter, but then I'm going to hand over the rest of the show to Leslie and Simone, who are going to take us through the highlights of State of the Sector report. So that's the research that's been done by, on behalf of Talk Community, to get a picture of the voluntary sector in Herefordshire, how that compares to the same exercise a few years ago, and lead on to what that tells us around what is the needs of the sector in terms of infrastructure support. And council commissioning team are here somewhere. Hannah here?
Yeah, she's in the meeting.
All right, so
the course.
Yeah.
Coming in, doing a thing about the course, but I can handle it.
Yeah. So Hannah will be introducing the infrastructure support situation for the council in terms of recommissioning and options. And then we're going to move on to an exercise with Leslie and Simone on your input on infrastructure support for the voluntary sector. Today, I'm presenting somebody else's slides, so apologies for that. So I probably won't have all the answers you might ask for. But it's about a scheme called Workwell. It's an ICB project that was put in for DWP, Department of Work and Pensions, funding earlier this year, and it was successful. And I'm going to go through what at a high level that project is and what the role in it is for the voluntary and community sector. So the idea is it's about £2.5 million across Herefordshire and Worcestershire, and it's a scheme to help people start, stay and succeed in work. So there's some criteria around this, so it's probably not aimed at the very economically inactive people, but aimed at those that are in work, struggling to maintain their work or recently out of work, usually on the grounds of some kind of health concerns. So the idea is people perhaps might not be starting work because of a health condition that might be able to be overcome with some support and reasonable adjustments. Helping people who are in employment to stay in employment, who might be struggling to hold down the job because of some kind of disability or health condition, and then helping people to succeed through coaching and various mechanisms to overcome barriers to them succeeding in their workplace. So the target of the project is to support 2,360 people between this October and the end of March 2026, and it's for anybody in Herefordshire that has an address in Herefordshire or is registered with a GP in Herefordshire or Worcestershire. And also, quite importantly, that they have an entitlement to work here in the UK. So they could be employed in any kind of organisation, in any sector, including self-employed. They might be in receipt of benefits and not working, and they might be not working and currently not receiving any support at all. So the idea of the service is that the next slide shows you a bit more in a visual of how the flow works, but the idea is it supports people with a triage, and then there'll be some health input through health coaches and an MDT approach, and the idea is that people could refer in themselves, family, friends or community organisations, employers, job centres. It could be sparked by going to the GP for a fit note or something like that. Health conditions expected to be covered. Part of the bid was around specifying what the kind of conditions would be, and there was a feeling that mental health and musculoskeletal conditions, and then other conditions that might require non-medical low-level interventions, where coaching or counselling might be appropriate. It's quite important to say that it isn't an alternative route to tap into NHS services. It's not a shortcut to get certain services in the NHS. and also around health conditions that don't affect a person's employment. So this is the model that's been put together by the ICB. So referral routes on the left, so could come through a GP, could come through SELF or other agencies like the Job Centre or community organisations. There'll be a triage assessment to determine whether the person meets the eligibility for the scheme, and then goes into what kind of support is required. So that could be health coaching, it could be a multidisciplinary team which would have some health input into that, or referral to an external partner or supplier. And I think this is the bit that's of importance to some of you, because that's where the voluntary sector might come in. And then somebody would exit the programme when they've completed the programme successfully. So at this point, the ICB are currently recruiting the team that will do the triage and the project management and the health coaching, and putting together the operational model for how that will work. And the role that they foresee for the voluntary sector is that two things. One would be to refer individuals you think might be might benefit from the service, and then there'll be details about how that's going to work further down the line. And then the other bit that really, this is the reason I wanted this to come as early as possible to the community partnership, is there'll be a role here for suppliers within the voluntary sector who might want to be part of the framework and deliver some of the interventions that people might need to be signposted to. And part of the bid that I helped with the ICB to put together was drawing on some of the examples we already had in Herefordshire of this kind of work that's happened before. So for example, BBO and things like that. This is along those lines, potentially extending to a slightly different cohort than that, but the kind of interventions would be similar in terms of supporting somebody in their volunteering and employment and skills development. So I think at this point, that's all I know, and I think it'll develop quite quickly between now and September. And by September, I think the ICB will be ready to give out more information about what the process might look like for voluntary sector organisations who want to be considered for the service provision. So David has put some information. So David Mahaffey in the ICB is the senior lead for this whole programme. And there will be a project manager soon. But at the moment, if you are interested in basically putting your name forward as finding out more about being a supplier for Workwell when the time's right, the person to email is his PA Caroline. So I'll leave that up there. I will say that I'm happy to take questions, but caveat with not knowing if I will be able to answer them. Oh, one more there.
The end, people who are successful and go into a role, or it says that they jointly decide to stop working with each other because it's not having an impact. So what happens to that person then?
I don't know, if I'm honest. And I think it's important to note that for some people that are going through this, they will have a role. They'll already be in employment potentially. So for some people, it's about giving them the health inputs that they might need and the coaching and support that they might need to maintain it. So it might be somebody who's been off sick recurrently and struggling to keep in work, but just about managing, but needs a little bit of additional support. So it wouldn't all be people who don't have a job. So I think the target for the Workwell is to really support people that are in employment to not become unemployed. But I think they recognise that there'll be a cohort that are fairly recently out of the job market due to health conditions. So the answer is I don't know what happens if it doesn't work for somebody and they don't succeed. I do know that there were two targets specified by the funders. One of them was a 70% satisfaction rate of all the people that go through, and the other was a 90% rate of uptake of the service to all the people that were eligible. And as far as I'm aware, at a high level, they are the sort of targets they're looking for. So I think they recognise that it might not work for everybody.
My question, I guess, linked in a little bit, so I said, excuse my ignorance maybe, but my understanding is there's a sort of occupational health system in place, and I'm not trying to, sort of be negative about this, I'm just trying to understand how that fits in, because when it said there's a referral from an employer, does that work alongside, do you think, the existence of, and I'm not asking you, I know you might not know the answer, it's just that initial kind of reaction to it of going, is this another layer?
Yeah,
Because something I know we get criticised a lot for in my area, and being quite new to it, is that we provide stuff and then someone else provides the same thing and then someone else provides it, and we're all pouring all this money in, which is what we're trying to change.
Yeah.
And I'm not trying to be negative at all, I'm just trying to understand how that fits in with the existing occupational health system.
I suppose there'll be a lot of workplaces where occupational health isn't that present or strong, will be the first comment. But I think with this, there's more dedicated specific health input. So there will be a routing to GP input, mental health practitioner input. Predominantly the team will be health coaching, but the multidisciplinary team that sits around it will have access to health professionals that don't really sit within your occupational health arena.
Oh, what?
Jenny, I think Jenny was first.
Thank you. And yeah, I think my question is building on this another layer as well. So I know that NHS IAPS are working with Landau around low-level anxiety, low-level mental health barriers to staying in or getting into work, and the young not in work or employment or training. And I'm just wondering, again, is this working with these people, or is it
I'd like to hope,
alongside,
being led by the ICB, that they'll be
ignorant?
knitting it in with services, because they commission that service. So I would hope that they wouldn't be doing it in a silo, but definitely make a note of all these points for David.
So this is about money, basically. Is an external partner or supplier of VCSE put onto an approved framework, and then you get a call-off contract because you've got one client being referred to you, and then you get £280 or whatever for 6 weeks support, or what kind of nature of financial?
I don't think any of that has been specified yet. So I think there's a lot to be worked out between now and September, so that the offer is clear as to what's in it and how that will work, if you're going to have a block payment for a number of people, or whether it literally is this much per individual as they filter through. I think that's for the team to spec out. So
Yeah, obviously with the nature of Herefordshire being rural, and even in Ross you might get one in a year, or you might get 30 in a year,
Yeah.
and that could be quite a different call on your resources.
yeah, exactly.
Good to know what you
And
think.
this might be quite difficult for the VCSE to develop a delivery model that works for them, because that figure, what was it, 2,360 people, that's a two-county figure, and I think they're expecting a sort of third split, so Herefordshire would be a third of that. So you're not talking vast numbers of people, and potentially not all of them will need the same things. So some might come through to needing some support from the VCS, some might need a lot more health input, and some might need a bit of both. So potentially, I'm not clear yet in the model how much is in it for the VCS.
No, it sounds like it might be better having one external provider with the contract, and that they then subcontract, so that you know that you've got the same coverage everywhere.
And I think there's scope for us to suggest those kinds of ideas around what we think might work for us. So I think if anybody's got thoughts and ideas, you know, happy to feed them in if you want to elaborate on.
Yeah, well, it seems very central to what Simone's doing at the moment, because this is a good example of where commissioning might not benefit the voluntary sector, and I can see why. I'm not suggesting that it should be a ridiculous commissioning exercise just so we can all get one person each for 280 quid. But,
Yeah,
but on the other hand, how can we think upstream to make it more appropriate for voluntary sector and its resources, rather than it being lost to, you know, Virgin contractor or something from London?
Yeah, absolutely.
You mentioned the funder. Who's the funder then?
Department of Work and Pensions,
And you
nationally.
also mentioned 2.5 million.
Yeah.
And you said it was a project manager to somebody other else. So does that come out of 2.5 million?
Yeah, so I think they're looking for something like 17 health coaches. I'm not fully clued up on the look and feel of the multidisciplinary team. I suspect it will be people that exist already in health services that are given additional funding to provide services into this model. So, yeah.
It doesn't need a lot from the voluntary sector.
No, potentially not. And I think the numbers are going to be small. Yeah.
And just on the word integration, which is a buzzword, I mean, you've heard people talk about fragmentation, as the same mentioned, or existing occupational health. There's obviously a restriction in place. Some acronyms that can't hear out.
Nobody can hear you because the microphone working.
So some acronyms were thrown out by this lady here, which I didn't understand. But who's integrating all of this so we don't waste resource?
The Integrated Care Board, so they're the
Right, okay.
the NHS Herefordshire and Worcestershire. Julia?
Thanks. Is that right?
Yeah.
I just wanted to say firstly that I think it's really great to see that the voluntary sector has been included in this scheme, and I think that is, you know, thank you, Christy, for making sure that we have been included. And I think for a lot of charities, the opportunity to access this support will be really helpful if they haven't got access to Opti Health. What I'm wondering is what the longevity of the scheme is, if it's funded, because for charities that have got access, you know, there is potential to look at maybe reducing or stopping paying for access and using this. But if it's a scheme that's only going to be around for 12 months, then that, you know, is potential. And I know you probably haven't got that answer, but I just wanted, is it something that's initially funded and will then be embedded, or is it a 12-month project?
So this is a pilot, and we were one of, I can't remember, about 10 in the country or something around that number. And so whether or not the DWP will take it forward at the end of the pilot, so that's end of March 26. So it's not a huge amount of time to embed something like this. Any other questions? Okay, so my name's Sarah Fishbourne. I'm from Impact Consultancy and Research. This is my colleague Max Bassett, and we have another colleague, Claire Carter, who's based in Shropshire. So we're really pleased to come along this morning and just give you a flavour of some of the findings from this current state of the sector research. So I'm just going to do the introduction. I'm going to pass over to Max, who's going to talk you through some of the statistics and key findings, and then I'm just going to do a bit of summarising at the end. So you may remember that we did similar research in 2021, and the purpose of both the 2021 research and the 2024 research is to provide insight into the size and scope of the VCSE in Herefordshire. So we've always said, and I think we've said this here as well, it's your research, you know, so what we want the research to do is to give you the information, the data, everything that you need to make your case as VCSE organisations in Herefordshire. And also it's useful, obviously, for the public sector as well, to understand the size, scale, scope, contribution of the VCSE. So what we were trying to do in terms of that contribution is look at that both in terms of the social contribution and the economic contribution. And in 2021 and in 2024, we've been able to put a figure against that. It's not an exact science, as I'm sure you will understand, but it does have a rationale and a methodology behind it. And we're also trying to demonstrate through the research how the sector is supported and works with others, and to identify the key issues facing the sector locally, which I know you will all be aware of, but particularly in terms of partnership working, it's really good to build that common understanding of what those issues are and how those could be overcome. And crucially with the 2024 research, we're trying to demonstrate how the sector has changed since 2021. So the 2021 research was very much a kind of baseline. So this is about, trying to begin to track those trends in change. So just before I hand over to Max, because I think we lost a slide somewhere when we we swapped the style of them. But I just wanted to let you know about some of the methods that we used. So we've created a VCSE sector database. So that's a database of all VCSE organisations located or delivering services in Herefordshire. And we've done that through secondary data analysis and also through the survey responses that we've received. And then we did an online survey. Max will tell you about how many responses we had to this, but we did an online survey in both 21 and 24, and as Max will say in a minute, the profile was very similar. And then we did interviews with chief officers from local infrastructure organisations and also with some of stakeholders in relation to commissioning services in the county, and we also held 3 focus groups. So that's where we've got all of our information and data from. So I'm sorry, just a bit of rustling now while I pass the mic over to Max.
Can you hear me okay? Can you hear me now? Yes. So, as Sarah mentioned, I call it a master database. So our figure, we've said that we've got 2010 VCSEs working in the county. This is based on data from the charity commissions, all the charities that are registered here. The Companies House registered, those who are identified as a community interest company or that type of thing. Registered societies list, the community amateur sports clubs, and also we've got an estimate based on the NCVO figure. So National Council for Voluntary Organisations have estimated how many small voluntary sector groups there'll be in a county based on the population. So all those figures, including our survey, have suggested that we've got just over 2,000 VCSEs in the county, slightly less than when it was in 2010. And the majority of them are registered charities. And a lot of them, nearly 80%, are small or micro organisations. That's generally based on income size, so those who have a turnover of less than 100,000. And the 534 below the radar groups, so these are the really small organisations that aren't registered charities or registered with sports clubs or Companies House. So they're really small sort of knit and natter type groups that we have. And the majority of them operate within the county, so just within the county rather than outside as well. Again, the majority, so our lots of very small organisations have been here a long time. So 68% have been operating for 11 years or more. The majority of them are work in the culture and recreation sector or the health and social care and wellbeing services. That's mostly what they do. And similarly to those, we've got a lot of small organisations that have lasted a long time, so over 11 years. 4% are operating have been operating for less than a year. So there is still some growth in the sector. Got about 1,200 people employed in the sector and 3,800 people who regularly volunteer. So what has changed? And this was a really interesting part of the research, and actually we are seeing some changes. So this graph is showing how we've got a downward trend in the numbers of people who work in the VCSE sector and who volunteer in the sector. And generally we've seen a decline in the number of VCSE organisations we have in the county. And all those are suggesting there's a general slight decline in the sector. And again, it'll be really interesting to have your feedback, see if that's what you're feeling as well. There's also been a decline in sort of the financial stability that people have been reporting through the survey. So we've had more groups reporting a heavier reliance on fundraising and grant income as opposed to earned income. And 40% have zero income from earnings. So again, that's much more reliance on grant sector funding, which we know in the current sector is quite difficult to get, and more competition to apply for. So the needs and the challenges of the sector. The majority of the VCSEs who responded to our survey reported that demand for services was increasing, particularly those in the financial management services. All of them reported an increased demand for debt advice and support. 60% of groups reported a risk to their groups not continuing in the near future, so that's quite a high proportion if money ran out and had to stop running. Increase in running costs as well. I think we've all felt the energy cost increases particularly impacting the VCSE as well. Less than a quarter of our VCSE groups could sustain the operating expenditure for 12 months or more. So that's obviously a real risk for 12 months' time. And the real risk that they reported on was about obtaining grant funding, challenges of recruiting volunteers, rising cost of utilities, and pressures on time. Hopefully that all feels familiar to you all. And 63% felt their financial position would either stay the same or worsen in the next 12 months. So what the groups also reported to us was that the support needs that they would like were around marketing and communications, policies and procedures, and insurance and risk assessments. So if there was an infrastructure support, that's the type of needs that they would be requesting from them. What we also reported as gaps in support was around funding support, accessing those grants, HR and legal support, general business development, so how we sort of progress over the next years, and help to recruit volunteers. So, excuse me, the unmet need, so what the groups reported where they either couldn't meet those needs or demand was higher than they could provide, were around combating loneliness and isolation. The need to offer more of the same, so they would like to continue what they were doing, but actually they couldn't currently. Transport, which again, obviously, probably all familiar with our rural county. Access to statutory health services. It was particularly GPs and mental health services. And supporting vulnerable groups, those sort of really vulnerable, that take up a lot more time, effort and energy to pull everything together. Support around cost of living crisis, which again leads very much to the increased demand for financial management and support. And a whole person approach is needed. And again, this is going back to the complex needs where actually they've got issues with lots of different types of sector, sort of employment, housing, health. So it's just pulling those all together. So the impact of the sector. So this is what Sarah mentioned earlier. This is a little bit of our modelling based on the data that we have. So this is what we think the sector is worth for the county. So ultimately it was 2,076 million per annum that the county that contributes from the voluntary and community sector. And this is based on 64 million from the paid employees 24 million based on the contribution of volunteers. So if all the volunteers and the hours were paid, it would be equivalent to 24 million. And 188 million based on the size of the organisations and what they contribute. And this is slightly less than when we did it in 2021. So again, it's suggesting a slight decline in the sector. However, we do have, I think, 2,300,000 residents who benefit annually from what the VCSE do. And that's equivalent to 383 hours a week of interaction. So per week, the sector supports that many hours. Although 30% of groups did not report using any volunteers. So again, that's the paid staff. So, which again could be down to some of the challenges with recruiting volunteers, or it's just not needed in that sector. And 355,000 total volunteer hours per annum.
So what I'd like to do now is just offer a kind of summary, really, of what we feel the key findings are from the research. And you may have your own analysis and interpretation of some of that data you've just heard. But it feels as though the sector in Herefordshire is in decline. There's less staff, there's less volunteers, the economic contribution has gone down. That's compared to 2021. We constantly hear about difficulties in recruiting volunteers, and it's good to think about that in the context of the volunteer hours worked hasn't gone down. So therefore, there's less people doing the same amount of hours, which in itself, brings, as I'm sure you are all aware, a lot of pressure on the sector. The financial resilience of the sector has deteriorated since 2021. So there are fewer organisations that are predicting that their income is going to go up. There's more organisations saying it's going to stay the same or it's going to get worse. There's a heavier reliance on grant funding and less on earned income. I think that's, again, a key point. The economic contribution of the sector has decreased, as we've already said, but the demand for services has increased. And again, I'm sure that this isn't news to anybody working in the sector. And what we saw reflected in the survey was that was especially around debt and financial management services, which is no surprise given the cost of living crisis which we are all in. There's significant unmet need around social isolation and loneliness. So when we did this research in 2021, mental health support came out very strongly. It's still there, but the overriding need was around addressing social isolation and loneliness in the 24 survey. And interestingly, the sector seems to be increasingly working in isolation. So we unpicked this point in focus groups, and what people said was, it's not because of a lack of willingness to work in partnership. We want to work in partnership, we don't have the time. Either our own organisations are in such a state of, I was going to say crisis, that might be a bit too harsh, but for some it will feel like a crisis, that we're just heads down delivering and looking after our own organisations. We'd really like the time to lift our heads up, look around, forge those partnerships, but when the sector is feeling under pressure, it feels like that's the first thing that kind of drops off people's list. And again, this was something that came through from the focus groups a lot. There's a lack of support for the VCSE sector to engage with commissioning and tendering processes. So we heard that time and time again in focus groups, that it just feels too big. It feels as though the facilitation isn't there. Maybe the political will, the willingness doesn't always feel like it's there either. It's not a level playing field. All of those issues, which we've heard from you, not just in Herefordshire, I have to say, it's quite a common issue with the sector. We've heard this many, many times. So it's still, people are still feeling that. But what, just I suppose to end on a bit of a positive note, given that bit of a gloomy picture, is that it's still evident that the sector continues to demonstrate its agility, fortitude and ability to adapt and respond to community needs. So despite this increasingly challenging context and environment, You're still all out there delivering what you do and doing it very, very well. Okay, so just in terms of the next steps, so the report will be published. We had feedback last year that our report was a bit dense. I mean, we're quite passionate about this research, so it was quite a long report and very detailed. So we're taking a completely different approach this time. We're doing a very short report that's mainly infographics, which we hope will be more accessible to more people, and then a longer report with all that detail in for those that want to delve into the detail. And then what we'd like is that the findings and the recommendations are used to develop an action plan and those, you know, that respond to those recommendations, hopefully to inform the infrastructure support for the county, which I know you're kicking off those discussions today, and also to drive forward joint working to meet future challenges and opportunities. That's it. Thank you very much, and thanks for giving us the time. Yes.
I know you asked a question, but I wanted to ask them if that's okay.
Thank you. Did the report drill down to what's working well in terms of infrastructure support and what's not working well? Which organisations felt well supported? Which ones didn't? Was there any pattern? Were they going for national sources of support? Were they going for local, or did they have it in-house? Was there any breakdown that could help inform this work we're going to do now?
Yes.
In terms of what's working well, what we could build on, what doesn't work well, and which organisations are struggling?
Okay, thank you. There is that breakdown, isn't there, Max? You've probably got it more.
Yeah, sorry, I didn't put that bit on there. I think it was mainly online support. That's where mainly people went to. That was their primarily one, and that was the same as in 2021. So it's online support and other community and voluntary sector organisations. Those were the two main ones where people sought support from.
Yeah, I mean, we've got more data as well in terms of what type of support people are saying that they need. And it's interesting that marketing and communications came out on top kind of in 21 and 24. And I know there have been some things done to try to address that since 2021, which, you know, it feels as though the take-up isn't always there in the sector. So I think what possibly needs to happen is that kind of next level of understanding in terms of how people want to access the support. You know, because if it's a day's training course, I don't think that's ticking the boxes. I think it's more accessible, it might be bite-sized, it might be, I don't know, it's for you to say. But it seems like the traditional kind of put a training course on to address a certain need doesn't seem to be working. But having said that, we also need to look at that in the context of a very challenging financial time for the sector, and making time to do anything other than run the organisation is very difficult. Are there any other questions? Is that okay, Simone?
I'm sure all of the people in this room would want to be ambassadors for this report, given that we're prepared to put the effort in it to at least come here. So, in terms of credibility, can you explain to us the 2.3 million for a population of less than 200,000? And can you explain to us the 1,000 hours a day?
Yes. Well, I'm saying yes. I'm sure Max can more than myself.
Yes, sorry, was it the impact one?
It's the one with all the numbers on that one.
That one?
You've got 2.3 million residents benefit.
Yes.
And you've got 355,000 total volunteer hours. That's 1,000 a day.
Yeah. So this is all based on the survey data. So this was each of the voluntary sector organisations reporting how many people they support, and whether that was across the year. So they maybe held one day event for the year, and 15,000 people turned up. Or it was that they supported 6 people continuously, daily, for 6 months. So it was just combining all that data to show that how many residents benefit annually was the easiest way to show it. Does that make sense for that statistic?
You've explained it.
Yeah. And then the volunteer hours per annum. So that was, again, the VCSE reports how many people volunteer regularly, and we broke it down this year into sort of professional support and sort of generalist support. So those who sort of turn up and do exactly what is needed on the day, we counted how many hours are given that week, and also those who sort of drop in and give 4 hours of support for a funding bit or legal advice or HR support. So it was all the VCSEs reported on those figures, and we just added those up for the year. So that's for all these. I mean, it's based on the survey data, which was 222 responses from the county. So chances are it could be a lot more, but we're based on what we do know. That cover.
Do you have the next question?
Hi, yeah, it's a really naive question, but what's an infrastructure organisation to those that are uninitiated?
No, I don't think it's naive at all. I think it's completely relevant, and I think that's something you're going to be exploring in the session afterwards. You know, what does that mean to you? But basically, we are defining that as anywhere where organisations go to get support. So where VCSE organisations access support. But that's something, and there is a national definition as well. So a typical VCSE infrastructure organisation might be considered as HVOS, for example, who support the sector. But of course there are others, and there are others in Herefordshire as well.
Hello. Sarah, the decline in Herefordshire, is there any national figures we can compare that to?
Yes.
Yes, no, I meant to put this on the slide, but I ran out of time last night. Yes, nationally, the sector is declining as well. So this is a trend we are seeing nationally. National data is about a year or two behind, so it's quite difficult to compare like for like. So we saw quite a stark decrease in the last sort of 3 years, but actually national data only goes up to 2022. So, but they are seeing a decline as well in both employees and volunteers.
Can I just ask a comment? Leslie Good, I have been working as the Service Director for Communities for the Council for the last year, and I'm also now working in community wellbeing and co-production. I'm aware that the last report, there was a number of recommendations that weren't acted on, either by the Council or by partners in the voluntary sector. And I'm wondering whether there may be some appetite to developing the action plan, the delivery plan in partnership between the voluntary sector and the council, so that we all know what bits we need to do to make it work. Would that be something people would value? Okay. Just another job for us. And you.
Just in response to that, actually, Leslie, I think that last time there were a lot of recommendations. Yeah. And some of them were very, very detailed, and we ended up in that situation for a variety of reasons. But I think having fewer recommendations with very targeted intervention behind them, I think would be more effective.
I'm Mike Cook from ECHO, and also chair of Herefordshire Activities Together, which is a group of social care organisations that come together. I was interested in the slide around the value of the voluntary sector. And one of the things that always seems to be missing, and is very hard to actually quantify, is if we saw that 60% decline in the voluntary sector, how much more would that cost? Because the real value of a lot of the services that we see here is that we are preventative. And actually, if people don't have those services and they don't have the voluntary sector, then the cost of delivering crisis services is huge. And so, I think there needs to be some work in looking at that and quantifying that going forward.
Yeah, I completely agree. It's really difficult. I mean, it's just very difficult, obviously, because that's the kind of, assessing the counterfactual almost, and it's very difficult to do, to come up with a figure to do that, but it's not impossible. As long as you're using a clear rationale. But yeah, I completely support what you're saying. I think it wasn't our remit for this research, but I think that research would be very useful to the county.
Something that I wanted to bring forward, and I don't know whether it's relevant for this part or would be for the next part, but a lot of the volunteer sector services which are out there aren't well known about within things like GPs, hospitals, things like that, not through them wanting to try to get out there, but even NHS funded services, for example, the service that I run, we're NHS funded, yet GPs don't know about us, the hospital doesn't know about us. Why? We're paid for by the NHS. We should be on some list somewhere which tells them about it, because there isn't that there, and there are places which are trying, like the Healthwatch list that's out there, the Joy list that's coming out soon, things like that. It's all out there, but there's so many little ones of them. Why isn't there one massive place that everybody goes to find volunteer sector services, so that they're known about, but also somewhere that sort of the funding element can come from? There are so many different places that you can go to try and find funding and things. Sometimes it's a full-time job just to look for where you're going to get the money from, and there needs to be something that's made a little bit easier for finding services and finding the money to keep the services going.
Yeah, I mean, I think you should hold on to that thought, because I think that's probably going to be very useful for your discussion that's coming up on infrastructure. But yes, completely agree with what you're saying, and it's always been an issue for as long as I've worked in the voluntary sector. You know, that is always been one of the issues.
A lot of voluntary and community organisations are dependent on the statutory sector in one way or another, through grants or commissioning or collaboration in some way. Have you evaluated the change in funding from the statutory funding that it comes to the voluntary sector, either by purchasing or other funding, commissioning or whatever?
Yeah, it's interesting, and no, we haven't. Oh, go on, Max. We may have done.
Sorry, in the survey we asked, where do you get your funding from? So we do have a little bit more detail about whether the sources were national funding or links to that, and income and grant funding. There also is one where it's public sector funded, but we haven't done any in-depth analysis of that, other than what proportions. How much money does the council spend with voluntary sector each? No.
No, I mean, it's probably a little bit out of scope of the research, but you know, as Max said, what we've got is where people are saying they're getting their funding from, so we have that, but yeah, we haven't done it from the other end, no.
Loading. I'll just introduce myself for anyone who doesn't know me. It's nice to see lots of familiar faces, but I'm Hannah McSherry and I work for Herefordshire Council. I work in the community commissioning team, and as part of our remit we look at how to support voluntary sector organisations and work closely with talk community to commission services for a range of different things, everything from domestic abuse, refugee resettlement through to voluntary sector support. Okay, so I know there's already been a question about, you know, what exactly is infrastructure support for the voluntary sector. So I have used, and I think that Simone also uses this definition from NAVCA, which basically talks about 4 different functions or pillars of support. So one around leadership and advocacy, partnerships and collaboration, capacity building and volunteering, all things that we've already been talking about this morning. I just wanted to highlight this particular piece of report from the King's Fund around actions to support partnerships. It's published in April last year, and it really talks about the main barriers and challenges that impact on partnership working with voluntary sector organisations. So I've really used this report to inform some of the ideas that have come up that I'll be talking through in the next couple of slides. But they particularly talk about commissioning, service design and delivery, about sharing data intelligence and insight and funding a sustainable investment. All things that are addressed in the slides as we go forward. Okay, so I'll just highlight the current commission service. So HBOS are a current provider, and they have had the contract for 4 years. They are provided to deliver the following 4 services that are highlighted on the slides. They are commissioned in a way that is complementary to the Talk to the Community offer that we have as a council. We've got lots of Talk Community colleagues in the room today. The council set aside a budget of 47,000 for infrastructure support in the current financial year, and this has been used to extend the existing contract with HBOS until the 31st of December, whilst we look at all the other options around future delivery and explore them with you. Okay, so I'm not sure that there's any need for me to go through the slide particularly because you've just had that presentation. But just in terms of talking about needs and gaps, we've talked about marketing and communication, clear policies and procedures that can be shared with other organisations, insurance and risk management, and about time being the biggest barriers to being able to access support. Some of the key gaps that have been identified is around funding support, HR and legal support, business development, and help to recruit volunteers. So I'd just like to kind of put a header out there really, the fact that these are just ideas, they are in no way a final version. We really value your input into this. We are conscious that as an organisation we don't have all the answers, and we need to work with the voluntary sector in order to support services and our communities. So these are just some ideas, and I know that we'll be going on to do some more work about other things that could be done. So we could let the existing contract come to an end and encourage the sector to develop their own response without HC investment or influence. I did have interference in there, but I thought I'd put influence instead. We've also got an option around using UK SPF Capacity Building Fund grant, which we've got, which is just for this financial year, and funding that we've got for a new Talk Community funding officer role as a short-term solution whilst longer-term solutions are being considered. Another option is to develop a grant scheme that VCSE infrastructures for VCSE infrastructure support, focusing on the 4 functions that were on that first slide. Or second slide, sorry. This would mean that the sector could develop projects that respond directly to the need and are more agile responses than perhaps we as a local authority could manage. It could be a short or long-term solution, but that would depend very much on your feedback. And it would enable a range of organisations to apply, offering specialist support services. But there is no long-term funding guarantee around that option. Another option is around offering VCSE support through a single contract as we do currently. The specification for this service would be based on the needs outlined in the State of the Sector report. And another option is around developing a framework. Now, framework is a procurement tool that we use that gives a lot of different options. So within that framework, we could be looking at voluntary sector support, but we could also be looking at health projects and working with public health colleagues to commission services. It's a way in which we could get ad hoc funding that we get from the government for specific projects, also out to the voluntary sector. It is not without its complications, because there is a process to go through in order to get on a framework, and we would be looking at how we could make that as simple as possible. But we would be broadly looking at a health and wellbeing prevention focused framework that could be used to commission quite a wide range of services, including voluntary sector support. So I'm really happy to give some more details about that, or if that was of interest. And the final thing is what I've already said, which is we are really open to ideas and other ways of delivering support to the sector as well. So that's a whistle-stop tour of the options. Has anyone got any questions?
you. Some observations, I guess.
Yeah.
One, we talk about the commissioning side and the sort of aims of those commissioning. Really important is to get people like the legal and financial teams involved, because that's where we find a lot of the difficulty and side doing. And I know there's a little bit of work that's going to go on with that. One of the other things which has come out of the survey is around the issues with the sort of long term within the sort of structure.
Yeah.
And obviously we're talking here that HFOS, who helped to put together the state of the service framework, have only been extended till December with their funding, and we know that HFOS, as our main infrastructure organisation for a while, we've seen them dwindle in terms of funding and that sort of drive. So I think there does need to be that thought about that longevity, and I think the worry with some of those examples is it is very short term and it's start-stop, and in terms of infrastructure and infrastructure support, there needs to be consistency within that. It seems to be a little bit more about what can the VCSE do to run those services. It still needs money. Yeah. It's not free. Volunteering's not free. Our services aren't free, and so that would again concern me, and whether the money is going into developing services that stay within the council and not come out to those VCSE organisations where we could use that money. And then my last comment, please no, is just around that sort of public health and that public sort of ICB engagement and things like that. Our experience has been that getting into that sector and getting funding from it is incredibly difficult. It's incredibly difficult as it is. It's even worse in Herefordshire, because although it's a Herefordshire and Worcestershire NHS and ICB, Herefordshire, in my opinion, is very much the poor cousin within that, and the infrastructure, the organisations that are set up that we're talking about have been funded and are much stronger in Worcestershire, and because of that, Worcestershire gets more than its fair share. So we're also suffering from that underinvestment.
Do you want to respond to that as well?
For information, just to let you know that Hannah mentioned the council have agreed funding for a grant funding officer to be cited within Talk Community, and that post will be advertised fairly soon. But we will also be retaining the capacity in Talk Community that many of you still use, with the development officers to do that, but there'll be more dedicated capacity. We also have a 36k UK SPF funded programme of capacity building, which will be being advertised fairly soon. On the Worcestershire Herefordshire thing, if you actually look at the government in Worcestershire, it's very different to here. The Voluntary Sector Alliance in Worcestershire isn't an infrastructure organisation. It's a different setup, and it's about the voluntary sector bringing itself together to work in a strategic way, and that's something that we'd like to explore with you, because I think sometimes when you commission one organisation to do that leadership, it seems like it's only the responsibility of that organisation, and I think I'm just suggesting things. So I just wanted to say, I don't think the Worcestershire situation is exactly the same as here, but also what I'd like to just let you know is this work is will be being reported to the One Herefordshire Partnership, and it's the first time that infrastructure support with the VCSE is being considered across the whole system, and not just by the council on its own. Can't promise it's going to deliver everything we want, but at least it's got a space in the thinking.
Sorry, I just wanted to mention Worcestershire because you mentioned Worcestershire. I'm Citizens Advice Worcester and Herefordshire, and we lead on the One Partnership, which is the Worcestershire Advice Network Partnership, and we're 7 partners across the county that have come together, and it's very much focused on prevention, on health and well-being, and we're funded through the county council to deliver our services. And we won the new contract last year, which is 550,000 over 5 years, And it's really important to us to have that 5-year planning so that we know, you know, what we can do over 5 years. And really important that we work together as well as a partnership, so the 7 partners working together, and it funds the core services, and it's the core services that we need funding. That's what people need. We spend half our time looking at being creative and trying to find something innovative, and it's like what we need are the core services, and that's what the clients need. So sorry to bring Worcestershire into it, but I wasn't the first person to mention it.
So can I just ask a question back? So the 500k that you got, was that for the partnership, not for you as an organisation? So it's like core services?
Yeah, that's
Yeah.
for the 7 partners.
Okay.
Yeah. Our services.
Mm.
And very much preventative and health and well-being.
Yeah.
And reaching the heart, the far to reach with self-improvement.
Yeah. Okay, thank you.
Yeah, hello, I'm Steve Cole. I'm the county chairman for the Royal British Legion. Can we stop or put an explanation on about these acronyms?
Yes.
Not everybody knows what they mean.
Okay, yeah, that's fine.
And it's something I push throughout the Legion. Don't use acronyms, you put it in proper. People understand you better that way.
Will do.
I just wanted to ask if you've been looking at how you work as commissioners as well, because for us, one of the hardest thing about working with commissioners is not getting the contract. It's then once you've got the contract, as was said previously, if it's a 2 or 3 year contract, and then you're waiting to see whether it's going to be rolled over until 1 or 2 months before the end of that contract, and that is frankly not acceptable. And I think sometimes people can get carried away with getting into something, and then actually that position that you're in with your staff who are delivering is really, really difficult. Uplift, you know, they're non-existent, so you might start with a contract that is full cost recovery. The contracts that we deliver for statutory sector across Herefordshire and Worcestershire, we are supporting all those through our reserves, and that is not something that can continue. I think it's really difficult, and particularly the short-term nature of you know, what you're doing. To have a 5-year contract is, you know, that is just the dream, isn't it? And I think that's something we need to be working towards.
Yeah, yeah. No, I agree with you, and we're definitely looking at how we can commission sooner, you know, start that cycle sooner, and also, you know, we are looking much more broadly at how we can co-design services as well. So, I do agree with you that a long-term contract is definitely offers stability, both for people that we're offering those services to and for the organisations. But I also think that we are often in a position where we are receiving notifications from the government around grant funding very late in the day. Like currently I'm waiting to recommission a service, and I don't know yet whether or not I've got the funding to do it because it comes directly from the government. So it's not an excuse, but it's an explanation of why that would sometimes happen.
I just wanted to make a comment about the ICB. I mean, we had a meeting with the ICB last week, and we talked about procurement and support for procurement. And one of the comments they did make was that large organisations are much better at procurement and they're always going to be more successful. So we've talked about very, very small organisations in the voluntary sector. So if you're going to ask them to compete with large organisations, then they're really at a disadvantage to start, which I'm sure I'm stating the obvious, but I'm just saying what's true.
Yeah, no, and it's a very valid point, and I think that we need to do more to make our processes accessible to as many organisations as possible.
Sorry, apologies, it's 330,000, not 500,000. We've just got 500,000 over 5 years from Access to Justice, which is split full-time benefits advisor, one in Worcester and one in Herefordshire, so it's 330.
You said that you'd give us more details on number 5. I'm not sure what it's got to do with infrastructure, because presumably you're talking about specialist delivery services to the public.
Not necessarily. So the kind of framework that we could develop could be a range of different things. So the beauty of a framework is that it's in process for a minimum of 4 years. It could be extended for another 2 years, depending on how we do it, under what legislation we develop the framework. And once an organisation has been through the kind of the pre-qualification process to get on that framework, we then can use different bits of money that we get to let work and opportunities through that framework. So when you're on the framework, there's no guarantee of any work, but what you would see is those opportunities coming through when funding does come through to us. So although as an organisation, our budgets are decreasing, we do get ad hoc grants and funding from the government and other sources as well. And the idea would be that the framework could be used to distribute them. So it could directly benefit infrastructure organisations that are offering support to other organisations. It's really about what that funding is coming to us for and how we then are able to pass that on.
Hi, I'm just going to just encourage everybody. I think it would be fair to say we all agree that having a good infrastructure support in place isn't the only ingredient to secure a sustainable and vibrant VCSE. But that's the one we're here to talk about today. And I just want to reassure you, I'm pretty certain that Simone through Paradigm and Christine through Healthwatch and myself working in that space will be making that clear that it isn't the only ingredient. There are other ingredients, some of which you brought up today, and I think the Council and partners will be looking at those going forward. But in the next workshop, we really want to garner your knowledge and experience of how we can best do the infrastructure support, delivery of good infrastructure support in Herefordshire going forward in the short, medium and long term. I think it's time for a break.
Okay. I think Leslie's just wrapped up for us.
Thank you, Hannah, and for the fact that you're doing this whilst doing your training course as well. So double thank you to that. Leslie did just raise a good point that actually infrastructure is one of the elements. Mike, you've raised some really good points. Once again, everything that's being raised here today is actually your opportunity to make that change going forward. So you've got the structure of Herefordshire Together and the community paradigm, which is now actually formally reporting into the One Herefordshire Partnership as well. So there is a structure, there's a reporting structure, and infrastructure is one of 6 elements that we're looking at. Commissioning is something that we are going to look at as well. So all the structures are basically, they're up for a bit of a revolution. So I'm going to suggest we take a break now. So there's going to be an hour's workshop breakout session. If we start at 11, where we are going to look at infrastructure. So this is a chance for us to actually go, well, what do we mean about infrastructure? What does it mean? And how do we want to do things differently? So how can we approach things differently? So we had a really good question about what do we mean by infrastructure. And Hannah alluded to what infrastructure looks like in her presentation. So when we talk about infrastructure, there are some clear definitions that have been put in place by NAVCA. And they are the National Association for Voluntary and Community Action. And they kind of have some guidelines about, well, what does it mean about infrastructure? So when we talk about infrastructure, we've got leadership and advocacy. Don't worry about writing any of these down. You've got some handouts on your desks. I've also got some more handouts for you as well, because there's nothing worse than having to write all this stuff down while someone's yabbering at you. So we've got leadership and advocacy, we've got volunteering, capacity building, and partnerships and collaborations. So when we talk about leadership and advocacy, well, I can't say either. There's obviously something about advocacy, too many syllables. What actually is it? So I've just put an example that's come out of my own head. Now, that's just my head. I don't want my head. I'll spend all my time in my head. I want your heads on this. I want your thoughts about what can we do differently when it comes to leadership and advocacy. It's actually, well, how do we create that community action? How do we strengthen our voices, and how can we influence those key decision makers and funders? I've just literally gone, the sector's working in isolation. Well, actually, we talk about partnership and collaboration, but we can also think about things differently. How about we actually share our space? with each other. You know, we could go and spend some time working at the council could come and spend some time working in the voluntary sector, literally. I'm not saying we sign up to that, but that's just an example about how we could do something differently. Volunteering, so obviously volunteering is absolutely crucial. It doesn't get any more important because we can't survive without volunteers. But actually, how do we do things differently for recruiting and retaining volunteers? Could that be a one-stop digital platform? That's for all our volunteering needs, you know, that all organisations can go on, find volunteers, bit of a matchmaking service. Once again, this is my head, I'm looking for your thoughts. Then what do we mean by capacity building? Very clear gaps in funding, marketing and legal support. So how do we fill those gaps? Because also we know time is an issue. So don't forget you've got the community chest. So obviously the community chest has come into being through funding from public health. But is there an opportunity for us to get that community chest and fill it up with people's time and resource from businesses, other organisations, or is there an organisation here that's got some amazing marketing expertise that they could share with another organisation? It could be something as simple as that. So that's just a thought. And then what do we mean by partnership and collaboration? And we all know what this means, but it is basically how do we all work together? So one of the things that we are identifying here is about the lack of support about engaging with commissioning and tendering process. Well, actually, you know, it's about Hannah's point about if we have this framework that people can then sign up and dip in and dip out, but also, Mike, you've raised some valid points. What other things can we do to work in partnership and collaboration? So there's partnership and collaboration within the sector, but don't forget the whole point of everything that we do is actually how do we partnership and collaborate outside of our own sectors. You know, it's not just necessarily the traditional sectors that we would collaborate with. Who else could we work with? Businesses, education, faith organisations. There's so much more that we can do. So that's what we mean by the 4 pillars of infrastructure. And then the last part of the workshop I want you to do is to look at the options that Hannah came up with for infrastructure support. So Hannah came up with, you know, 5 different options, but there is a 6th option, which is actually how would we do this differently? So actually this is our chance to go back to the council and say, you know, this is how we think we should commission infrastructure support. So you have got 2 aims for your workshop. So the first aim is to talk about the 4 pillars of infrastructure. What I'd like you to do, and the second aim is about the infrastructure support, I'd like you to get into groups of 6. So I'd like you to move. I know that's a good thing. But this is, if I could get you to all kind of mix up your tables, you know, work with people that you haven't worked with before, that bit that we all hate. But it is actually really useful to have a conversation with people that you haven't spoken to before. So tables of 6, pick 2 of the 4 pillars, because all 4 pillars are pretty sizable. Pick 2 of the 4. I'm going to come around to each table with some further information just in case you get stuck. So I want you to discuss 2 of the 4 pillars. I want you to come up with challenges, opportunities. So, you know, it's basically what are the things that people might hold us back, but actually what are the things that we can do differently? Because then this will start to form part of the action plan on the back of the state of the sector. This will form part of the infrastructure work stream that will go into the One Herefordshire Partnership. This will actually start to form some real solid plans. And obviously this will then help Hannah and her team involve you guys and inform her about actually what's the right way to commission infrastructure support. So you have until 12 o'clock. Get into teams of 6, tables of 6, grab a cuppa. So you've got 2 things, you need to discuss 2 of the 4 pillars, and you need to talk about infrastructure support. You've got some handouts on your desk, which are basically what I'd like you to do. I'm going to come around to each table with some further information when you decide which of your 2 pillars are